Honey hush, have you heard? They want to get black women and experiment on them. Girl, that's not what it's about. Yes, it is. Have you read about it? They're asking black women to sign up for an experiment. How do you establish trust? How do you establish trust when you feel like your healthcare is in the hands of someone else? We as Black folks in the United States have a history of being subjects to medical experimentation, medical disregard, and medical mistreatment while experiencing medical illnesses and cancer at comparable rates to others
or higher.
in our society. The American Cancer Society has been around since 1913, helping to educate and to do research and to help to eradicate cancer. It was estimated by the American Cancer Society that in 2024, this year, every minute, 4 new cases of cancer will be diagnosed and 1 cancer death will occur every minute. Blacks have been underrepresented in cancer research, and now the American Cancer Society wants to hear from Black women. The American Cancer Society has launched Voices of Black Women, taking into consideration that 90% of Black females between the ages of 25 and 55 live in 20 of our 50 states. Side note, looking at this map makes you wonder whatever happened to the Great Migration North by Blacks, and when did we all move back to the South? Open enrollment for Voices of Black Women is occurring now. The goal is to recruit 100,000 Black women between the ages of 25 and 55 years. These women are to provide information about their lifestyle, their environment, their health history through online surveys, which are to be done at least twice a year. This study is slated to last for at least 30 years. This is not a clinical research study where women will receive medications. This study will look for associations, such as, do Black women who use hair relaxers have a higher incidence of uterine cancer? Personal health information, Social Security number will be asked for. The provided information will be anonymized. Researchers seeking this data will be given access to anonymized information, at which point there may be requests by these researchers for additional testing, i.e., labs, genetic testing. All of this is voluntary. All of the surveys are online. Withdrawal can occur at any time. However, any information provided will remain within the database. So what do we know about cancer in Black females? The following data has been provided by the American Cancer Society in their American Cancer Society Cancer Facts and Figures for African American Black People 2022 to 2024. Heart disease remains the number one cause of death, followed by cancer. And despite Black women having a higher incidence of obesity, lower socioeconomic, less access to healthy foods, less physical activity, these risk factors don't necessarily translate into a higher incidence of developing cancer. More often, Black women are at a higher risk of dying from cancer rather than being at a higher incidence of developing the cancer. And if there isn't a higher incidence of cancer, despite these risk factors, but yet a higher incidence of death, does this suggest that the probable cause is lack of or inadequate health care? Is the differential in mortality rates evidence of structural racism within our healthcare system? Questions like this need to be posed and need consideration. Thanks to HEnrietta LAcks, the 31-year-old mother of 5 who presented to her gynecologist with vaginal bleeding, which was ultimately diagnosed as cervical cancer. Thanks to HEnrietta LAcks, her cancer cells, the HeLa cells, were used in the past for research, for profit, without the knowledge or benefit of her or her family. Thanks to HEnrietta LAcks, legislation has been passed. The HEnrietta LAcks Enhancing Center Research Act was passed in 2020 for the government to study and to publish reports regarding barriers to participation in federally funded cancer clinical trials by populations that are traditionally underrepresented in such trials, i.e., Black females and others. And if we accept that mistrust has been a reason for underrepresentation in clinical trials, the question that we come back to is, how do we establish trust? One suggestion: transparency. Invite Black women into the design of clinical studies, not just in the implementation of data collection. Involve Black women in clinical review of these studies. Involve Black women in the interpretation and the appropriate follow-up of these studies, knowing that one study doesn't necessarily confirm anything. What is required is repeated studies with confirmation of results. I look forward to this discussion and much more in upcoming podcasts. And until then, this is Dr. Rahman, and this has been Black Women's Health Podcast. Take care and be well.